The current restrictions with COVID-19 are making nursing in the inpatient unit, in particular at Te Omanga, quite challenging. We have allowed each patient that comes into the unit to bring one member of their bubble or their family with them, but they've had to stay locked down in the hospice with us. We provide all of the food and meals for the family that are staying, but it does make it really, really challenging for the patient as well, because the patient has to choose in their family bubble who's going to come with them. We've had patients who've said that I don't want my daughter to be with me. As much as I love her, my son will cope with this better. It's not going to be what they perceived it to be, maybe when they thought about dying 6 months earlier, but in our own way, we're creating our own funerals. So when a patient is picked up by a funeral director, we have a team of staff who maintain their social distancing within our Te Omanga bubble, but they go out to the car and we sing one of our lovely songs and make a ritual for that family. I think one of the biggest challenges that the staff have faced is not being able to be emotionally connected with the patient and the family. So there's no hugging, there's no touching, and that's very much a part of who we are. We are huggers and touchers, and it's just how we deal as human beings with emotion. Most of our patients are choosing to die at home so that they can have their extended family around, they can have their children and grandchildren with them. Families being able to provide the care at home with just phone support, which is what people are doing at the moment, is empowering them. If death goes well for somebody at home and they feel empowered and they've done it and they've succeeded, then the children and the family that are around them carry that through in their lives. They can look back and reflect on how well my mum or my dad did so well looking after my grandparents. Children are going to see that death's actually normal because it happens at home, and it can happen at home. We don't have to be in a hospital, we don't have to be at a hospice. It can be done beautifully at home with the love, care, support of the people that matter around them.